Thank you. Senator Braun.
Thank you, Madam Chair. In March of 2021, American Rescue Plan was signed into law, $4 billion to address the opioid epidemic. But with that, the lack of anything substantive in terms of trying to crack down on the source, fentanyl is mostly made in China, trafficked through Mexico. Listen to these statistics. I want the public to hear it mostly. 100,000 Americans have died in the last year due to overdoses. Many of them, if not most of them, from fentanyl. This is the part that is most shocking. In the age group, 18 to 45, we've lost more young people from overdoses than COVID, car accidents, and suicides. So it's another example of where spending money was not a solution without real teeth, real substantive directives at the source of it. We visited the southern border a little less than a year ago, and we were going from record low illegal crossings to about 70 to 75,000. That's now leveled out at about 170,000. I mean, appalling. I've got two questions, both for Ms. Goldsby. When it comes to not only the impact on losing lives, but along with workforce to boot, I think we've lost close to 2 million prime-age workers due to the fact that they're contending with opioid issues. How much of this issue is directly related to the policies we have on our southern border, where illegal crossings are up, fentanyl comes along with it? How much has that contributed to this tragic loss of life?
Senator Braun, thank you for your question. A couple of things. My expertise rests with prevention, treatment, and recovery service delivery. But, from 2018 to 2019 in South Carolina, we were really making headway and saw the number of overdoses leveling off due to all of our efforts and all of the federal funding with state targeted and state opioid response funds. Since then, and in the last 2 years, our overdoses have skyrocketed, and we're estimating about 63% of our overdose fatalities in 2020 were a direct result of the extremely potent illicit fentanyl in the drug supply. I think in the last 2 years, we have pivoted to doing everything we can to keeping people alive and implementing evidence-based harm reduction and intervention services. We've got naloxone everywhere that we can get it, the life-saving antidote. With the flexibilities and the funding support from SAMHSA, we've been able to distribute fentanyl test strips to those individuals who may not know what substances they're ingesting, as the illicit fentanyl has gotten into the methamphetamine supply and the cocaine supply. And the evidence suggests that people are better able to prevent an unintended overdose death if they use these fentanyl test strips. They are using less of the drug, and every interaction to get these supplies to people on the streets where they are is an opportunity to engage them in treatment services and get them on the path to recovery. And so that's where our efforts are focusing so heavily now. And I'll say we're not feeling defeated, but it's been a major setback in the last couple of years with how dramatically things have shifted.
Well, thank you. I think without directly saying so, by deduction, you can relate what's happening on the southern border to what you're grappling with. Senator Markey and I have got two pieces of legislation about increasing provider and patient education. One is the Label Opioids Act, and the other, the Safe Prescribing of Controlled Substances Act. Through your work in addressing the opioid epidemic, can you speak to the importance of provider and patient education and how these bills might impact that? Ms. Goldsby.
Senator Braun, thank you. Sorry. I think the patient and provider education is key, and we have a long way to go, especially with our provider education and all of our healthcare workforce. I think it's been a theme today that we've talked about, folks not understanding addiction and mental health issues as disorders, addiction issues as chronic diseases, and the evidence-based services, interventions, and treatment models that address these disorders successfully. And so we've come a long way. We've invested a lot in our response and engaging the workforce as such, but I know that we have a long way to go, especially as we contemplate access and what that means for people who are approaching healthcare providers who don't or don't know how or don't address addiction appropriately.
Thank you. I'd like you and the other members of the panel to take a look at these two bills. It'd be a small step in at least trying to get more information out there and to weigh in on maybe endorsing both of these pieces of legislation. Thank you.
Thank you. Senator Kane.